Chapter 10. Stress is our body's natural response to internal and external demands. However, severe stress is unhealthy and can increase the risk for physical and mental illness. And then you have stressors. Stressors are an event, situation, or condition that results in psychological or physical stress. Now, stressors can be internal, so in the individual, or external, outside of the individual. Stressors can also be acute, so they're necessary for survival, or chronic, and that means it's lasting a long period of time. So I told y'all in Module 1 to be very familiar with Adverse Childhood Experiences, ACEs. You're going to hear about those all semester. So ACEs are traumatic events that occur between the ages of 1 and 7 years old, and they affect the person's overall health. They include psychological, physical, or sexual, violence against a parent, particularly the mother, or living with a person that has a substance use disorder, a mental disorder, or has been incarcerated. Early intervention to reduce stress is important for the patient to effectively heal, successfully cope, and use those coping strategies in the future. We've all heard of fight or flight. The fight or flight response is considered an early stress response theory founded by Walter Cannon, which focuses on the human physiological response caused by stressors. Each response is the person's attempt to avoid stress and regain control. So see this picture here at the bottom of the slide. Fight. This is when you face the stressor or the situation and you're ready to confront or fight. You will experience anger, aggression, stomping, kicking, things of that nature. Now, flight is when you run away from the stressor or the situation. You experience anxiety and feeling trapped. You're tense, you're wide-eyed, and you're restless. Freeze is when you're unable to respond or react against the stressor. You experience dread, you have a pounding heart, you might be numb, you might have pallor, you might even be holding your breath. Fawn is when you attempt to please or give in to this stressor. You experience self-directed anger, you have lack of boundaries, no identity, and you ignore your own desires. And faint. This is limiting exposure to the stress by physically fainting. You experience changes in vision, you feel lightheaded, and you black out. Then we have our equilibrium. So equilibrium is achieved when the perceived threat is gone and the hypothalamus tells all of your affected body systems that they can go back to normal. But prolonged activation of the stress response can produce detrimental effects on your body. General adaptation syndrome was another early stress response theory founded by Hans Seil, which incorporated parts of the fight or flight response, but also included the hypothalamus, pituitary, and adrenal glands. Now, he says there are 3 stages that include alarm, resistance, and exhaustion. So alarm, this is an acute phase when the sympathetic nervous system is activated and it results in shock and counter shock. This stage is very intense and it cannot be sustained for a long period of time. Resistance is also called the adaptation stage, in which the body attempts to adapt to the stressor. If the stressor diminishes, the individual returns to homeostasis. But if the stressor does not diminish, the individual moves into the final stage, which is exhaustion. Now, exhaustion means the body has depleted its resources and can no longer adapt to the stressor. Exhaustion can lead to illness, disease, or even death. On page 156, you can refer to table 10.2 for some reactions to acute and chronic stress. So good stress and bad stress. There are positive stressors. And this is considered eustress. Positive stressors or eustress are challenging but beneficial stress that results in development, growth, mastery, or a sense of fulfillment. Examples can include the birth of a child, marriage, buying a home, starting a new job, or graduating from school. But there's also negative stressors, and this is considered distress. This leads to the depletion of energy and exhaustion. It results in a decline in function and performance. Examples include the death of a loved one, financial burdens, divorce, abuse, hospitalization, or injury or illness. So, how a person responds to stress can be affected by genetics and environmental risk factors. Self-appraisal and awareness of stressor plays a significant role in the ability to self-regulate, to manage emotions, and to manage thinking. Self-regulation is fostered through safe, stable, and supportive relationships in early childhood. So the immune response to stress. Interaction between the nervous system and immune system during the alarm phase of the general adaptation syndrome or GAS. It negatively affects the body's ability to produce protective factors due to stress hormones weakening the immune system, which results in increased susceptibility to illness and infection. So our health impacts our stress levels. You can look at this slide independently. So there are lots of physical manifestations of stress. We can develop body aches and pains, chest pain, heart palpitation, exhaustion, insomnia, headaches, high blood pressure, muscle tension, stomach and digestion problems, sexual difficulties, weakened immune system, dry mouth, sweating, shortness of breath. But there's also psychological manifestation of stress. This can be anxiety, irritability, depression, panic attacks, increased sadness, increased worry, eating disorders, substance use disorders, or addicting behaviors like gambling, alterations in executive functioning, including language and problem solving, delayed development or regression, compulsive behaviors such as shopping and sex. So I'd like you to think about the main reasons behind our stress. And let's dig down. Stressors can be physiological, so environment or physical, or psychological, so a stressful event, like a final exam. Perception is the view of stress by a person that determines how that person reacts to it. One person reacts completely different from another person, and this can be affected by age, gender, culture, your life experiences, as well as your lifestyle. Individual temperament is an individual's personality and includes their genetic structure, vulnerability, childhood experiences, coping strategies, and personal outlook on life. A strong social system buffers against distress while enhancing mental, physical health, and this can be family, friends, neighbors, co-workers, etc. It also includes support groups in the community or even online. So we've talked a lot about culture, but think about how different cultures view stress. And finally, spirituality and religion enhances our well-being and provides a sense of hope. On page 159, box 10, shows the level of stressors here. So Maggie, a college student, is experiencing stress in her life. I don't know what to do, she says. I mean, this is supposed to be the awesome, exciting time in my life. Finally going to college. I love college. I love being a student. But honestly, trying to juggle my schoolwork, job responsibilities, and single parenting is starting to make me feel pulled in a million different directions at once. Maggie is aware that she needs help. On the 3 afternoons a week before she starts classes, she has lunch with her 2-year-old daughter on campus, then goes to a yoga class right on campus that also provides childcare. After yoga, her sister picks up her daughter, and Maggie goes on to class. I'm trying, Maggie says. It's still not easy, and I still feel a bit overloaded. But this at least is making some difference. It's a start, a step. Which stage of the general adaptation system is Maggie most likely experiencing? She's in that B, resistance, or that adaptation stage. So measuring stress. Social Readjustment Rating Scale measures positive or negative events, and it's designed to assess a person's vulnerability to stress. There's also Recent Life Changes Questionnaire. This assesses stress levels for the past 6 months or 12 months based on changes in a variety of categories. A score of 300 or more on the 6-month exam and 500 or more on the 12-month exam indicates high level of stress. And on page 160, table 10.4 is an example of that Recent Life Changes Questionnaire. And then the Perceived Stress Scale measures perceived stress, but there is no absolute score, so it is a good indicator of how overloaded a person's life is. On page 161, figure 10.4 is a perceived stress scale. So coping styles. Problem-focused coping styles is action-focused and requires adjusting or managing the problem that is causing this stress. An example is a patient who creates a list on how to tackle the issues to reduce their stress. Emotion-focused is action-focused also, and it helps to reduce negative emotions associated with stress. Example, a client seeks out support and resources that nurture their emotional health. And avoidant, this is a passive approach that focuses on ignoring or denying the stressor. An example is when the client avoids the stressor by drinking or sleeping. Problem focus and emotion focus are both adapting coping mechanisms, while avoidant is considered maladaptive. And finally, managing stress. As mentioned before, unmanaged stresses leads to physical or mental illness, so it is important to incorporate education for patients regarding activities to reduce or manage their stress. So let's just talk about a few of them. Biofeedback is an immediate feedback on activities such as heart rate, temperature, blood pressure, etc. So think about your smartwatches and their capabilities. Deep breathing exercises are the most common relaxation techniques used in the U.S. Guided imagery focuses on calming or pleasing scenery that replaces negative thoughts and feelings. Progressive relaxation is purposefully tensing groups of muscles and then relaxing them to decrease tension. Box 10.4 on page 163 explains that to you. Meditation is training the mind to become calm by focusing on your inner self. Mindfulness is a form of meditation that focuses on being in the moment and paying attention to what is going on around you. And you can find this in box 10.5. Physical exercise should be performed at least 3 hours a week. Cognitive reframing is changing perceptions by reassessing the situation and replacing negative or irrational thoughts with positive statements. Journaling is especially helpful in the grieving process. Humor. We all know that laughter is the best medicine. I would be familiar with my boxes in this chapter as well.